All right, it's time for your health. But before we can jump straight into that segment, here's a quick update. Turkana County, with a predominantly pastoralist community, has long been hard to reach for the ideal health services. HIV care is no exception. As Dr. Masikoria, our medical correspondent, reports, prevention of mother-to-child transmission of the virus has been taken a notch higher by making diagnosis easier and faster.
The 4% prevalence rate of HIV in Turkana County could be accounted for by the fact that Turkana is on a transit zone. It neighbors Uganda to the west, South Sudan to the northwest, and Ethiopia to the north. Additionally, many NGOs and other organizations have development projects in the county. This means that many of the people working for these NGOs are not originally from the Turkana community. As a result, many women are at risk of contracting the virus, this putting their unborn children directly at risk of mother-to-child transmission of HIV. Let's call her Aspita, though that is not her real name. At 24 years old, she's a mother of 2. This is her youngest child. It was during this last pregnancy that she was diagnosed HIV positive.
Alikuwa na wasiwasi wakati alikuwa mjamzito, alikuwa anafikiria mtoto wake anaweza muambukiza. That's why alikuwa na wasiwasi kabisa wakati alipatikana kwa positive.
Living a few kilometers from Aspita's home is yet another young mother. We will call her Akiru, and that also is not her real name. She is 19 and was also diagnosed while pregnant with her second child. She had a lengthy chat with her husband who works out of town.
Naambia sio peke yako ndo wa kwanza. Labda kuna mahali tulipitia ama alipitia lakini hakujua. Safanya hivi tunataka tufanye huyu mtoto awe na malezi bora.
For many of the mothers with HIV-exposed infants, that is the main worry, the future of their babies.
If the virus is not detected early, within the first 1 year, 30% of them will have died. If at all we delay care and treatment within the next 2 years, 50% of all those HIV-exposed infants will die.
Early infant diagnosis of HIV means that mothers can be at ease knowing the status of their children.
Napeleka result Eldoret, ndio baada ya mwezi mbili ama moja ndio kuja upate result. Hayo mwezi sasa nikarudi, wakachukua mtoto dawa. Nilikuwa na hamu sana kujua hali ya mtoto.
HIV-exposed children are supposed to be tested at 6 weeks, 6 months, 1 year, and 18 months of age to determine their status.
For a long time, we were using the antibody antigen test, which when a child is born, he carries the maternal antibodies for 18 months. Mothers who are HIV positive and who bring forth HIV-exposed infants previously had to wait for 18 months for them to know whether this child truly has HIV or not.
Tulikuwa tunahangaika kabisa. Yaani tunastuka tunaweza result imeenda huko. Itarudi lini sasa tuangalie tena result. Maybe sasa mtoto na ameambukiza ama nini.
Nilikuwa na wasiwasi, nasema nitampata mtoto wangu ako naye ama kuna, yani nimeongoja nikakuja kila siku na uliza daktari ije kuja bado.
Infants are very sensitive and need to be put on treatment immediately, especially if they are HIV positive, because we know that even at the time they require the 6 to 8 weeks test, 10 to 15% of the infants will have died.
It is in this regard that this point-of-care diagnostic machine was installed in Lodwar County Referral Hospital. Mothers are informed of their child's HIV status within an hour.
When we used to send our samples to AMBAT, we used to analyze within a month. We only had to send less than 20 samples, and getting results was taking 3 months. But since we installed this POC in our facility, so the numbers now they are spanning up to 48 per month. All the clients, that is 100%, all the clients are getting their results within 1 day.
This is significant progress.
Yani ya leo inadhinika kabisa, yani inatupa motisha. Ya hata tukieni tena tunatamani tena tupate mtoto mmoja tutupime haraka zaidi tuendelee.
Matokeo ya mtoto yamerudi, na kama vile tuliongea hapo mbeleni, mtoto akichukuliwa damu tunatarajia matokeo mara mbili. It's either iwe positive ama negative. Matokeo ni negative, inamaanisha mtoto ana virusi.
With this possibility of diagnosing their infants early, the women here can rest easy knowing that their children who are negative can continue to live negatively, and those that are found to be positive can continue on the right antiretroviral therapy. Dr. Mercy Korir for KTN News from Lodwar County Referral Hospital.
And that forms the basis of our conversation this morning, self-testing kits. And of course, with me here in studio, I have two great people who help us understand how this is going, and ever since it was launched in Kenya, how that has come to effect. Of course, sitting closer to me is Kip Kerich-Bera. He is the program lead for Global Fund. That's from the National Public Health Labs. And of course, closer to him on my extreme left, that is, I have Mary Mugambi. She's the program manager of the self-testing at NASCOP, and both of them will help us understand this very well. Good morning, and thank you so much for your time.
Good morning.
Mary, I'd love to start with you. Ever since the self-testing kits were launched here in Kenya, about actually a time like this last year, May 2017, how has the response been on the ground?
The response has been overwhelming. A lot of people want the kits. Actually, our demand is not meeting their supply, but we are working on it. Our biggest problem is the fact that we have not been able to reach out to every Kenyan, but we are in the process of doing that. So since last year now, we want to go into the public sector. You know, before we were giving kits at pharmacy level, right, where you could procure a kit for 500 shillings, which is ongoing even now, by the way. But now we want to go to public facilities. And in our public health facilities, we will be giving the self-tests. Like for pregnant mothers, once a pregnant mother tests, using our usual other tests, we will be giving her self-test to take home to the partner. Once we screen her for IPV and there's no risk of intimate partner violence, then we'll give her a kit to go and test her spouse. And that way we'll be able to bring in more males knowing their status, which is our big problem. Men generally don't know their HIV status.
And that is still a challenge till today?
Yes.
And you believe that finally, once you get the kits towards the mothers or the women, that will encourage men within our society to become a bit more active when it comes to self-testing?
Yes. Men before used to rely on the test results of their pregnant wives. So if the pregnant woman goes to the facility and gets tested, the man thinks, oh, I'm also fine, it's negative. But we know discordance, where one partner is positive, another one is negative, is very high, about 40%. So we want to bring in men for testing. Okay. Primarily men don't come to facilities.
That's high.
Yeah, that's high.
All right, let's talk about the accuracy of the self-testing kit. How accurate are they?
Our self-tests are very accurate, over 95% accurate.
Over 95%?
Yes. And of course, if you follow the manufacturer's instructions, and of course, we have also our support systems. We have an app with videos, and you can look at the video before you do the tests. We also have our 1190 helpline number, where you can talk to a counselor, even as you go through the test, and they can assist you through it. So it's very accurate. But we say it's a screening test. So if you come out negative, you're negative. For those who have a positive result, we will need further tests done at health facility for confirmation.
So it's not always the end?
No. It's just like the way you screen yourself, Lindsay, for a pregnancy test. You'll still go to a health facility for confirmation. You'll screen yourself for diabetes, right?
Yes.
And then you'll go to the facility also for confirmation. So basically, these are screening tests. And this test is basically to populations that primarily don't come out and do testing. And that's why we are saying populations like the men, key populations, people who are really highly stigmatized and don't actually access our usual testing points. Okay. That's who we are targeting.
Kip Kerich, as the head of the program, as the program lead, how can we loop men into the conversation? How can we tell them there's a self-testing kit which can help you and empower you better?
I think the first thing is the product has to be promoted, and it has to be promoted to where men go, and especially the social issues surrounding HIV testing has to be handled. Men somehow don't come out to test most often, because women happen to have come out, and by nature of carrying pregnancy also, women get to be tested in PMTCT program, so it's more acceptable. It's like, I think a certain segment of the men has not been reached, and we need to come up with strategies to be able to test more men. And men-friendly service is something that we need to promote, especially the media. And therefore, the state, you need to promote men to come up in testing. Basically, as National Public Health Labs, under the National HIV Reference Lab, we have the mandate to be able to do validation on behalf of the regulator. The regulator here is KMLTTB, established under the legal statute in CAP 253A. And their mandate is basically to validate in vitro diagnostic devices in the country, register them, so that they are able to be sold and used in Kenya. So essentially, the issues of quality are factored in because fitness for purpose has been established by the regulator through appointed gatekeepers who are the National HIV Reference Lab under the Division of National Public Health Labs. So we essentially prove that the devices are working properly, and we will keep on monitoring them once they are deployed in service delivery points at our facilities. And that's basically important because sometimes during transportation, shipment, or storage, there's deterioration of these test kits, and we need to have mechanisms, systems to be able to monitor. Also among providers, having this test kit is not a guarantee that you will get quality results. Basically, there are so many other inputs that requires investment. One is training for the service providers. Number two is quality assurance in terms of testing the competencies of those providers from time to time, and also testing the products whether they are still potent enough to be able to deliver accurate results. So basically, they are all system is tied together to ensure that a quality results is delivered. But this device for self-testing is just screening. It is not a confirmatory.
Speaking of deployment,
yes.
Where can Kenyans get the self-testing kits? Are there authorized clinics or organizations? Is there a standard price, Mary?
Yes, we have pharmacies that are stocking the kit currently, and our partnership with PS Kenya. And so far we have 123 pharmacies in Nairobi and Mombasa, yes. And each kit goes for 500. We have Oracle going for 500 and the Instis test. Each goes for 500. Inside the kit are instructions, and they're just simple instructions. We're also working on translating the videos into local languages.
And that's what I was actually going to ask, because then again, what are the plans and how far are the plans when it comes to getting these kits to places beyond Nairobi or Mombasa, places like Turkana, Mandera, Garissa, etc.?
Okay, the kits have already been distributed. We are currently, this week, doing the training for healthcare providers. Turkana, that has been featured there, is one of the counties.
Oh, so it's already under distribution?
Yes, it's under distribution, and we have distributed about 200,000 kits of the self-test, the oral-based tests. And we hope now it can be able to get to the local Mwananchi. Yeah, within those counties, like Turkana is one of them. We have Kiambu, we have Homa Bay, we have Kisumu, we have Migori and Kisii. Those are some of the counties where we looked at. And so that we are not performing very well in terms of people knowing their status, so we start with those counties. And that is, of course, because we don't have sufficient kits for now.
Yes.
But we are working with partners to get more kits so that we can be able to offer. What we are offering in the grassroots, like the counties, is free. We don't charge anything for it.
So what you'd buy for 500, for them it's free?
That's pharmacy. Pharmacies are those who sell. But in our health facilities, we don't sell. It's free.
Okay. So when we come back from this quick break, because it's quite interesting, there's this, and there are these two.
Yes.
Both self-test kits, but two different.
Two different. The one on the Insti self-test is a blood-based test. You will remove some blood from your finger, put it in a solution, and observe the test. The OraQuick is oral. You scrap your gums, the upper gum, the lower gum, put it in a solution. In 10 minutes, you can read your results.
All right. So more with Mary and Kip Kerich when we come back from this short commercial break. And of course, we'll get to know how this works. Hopefully, we'll get to open them for our audience to see. So stay with us.